So it's pretty fair to say that Jeremy Hunt is a disaster as Secretary of State for Health. He's hated by doctors, by journalists, by much of the public at large. He has to run away, shamefully, from journalists on the streets of Westminster as they beg him to ask questions about why the NHS is in freefall. I think he should resign as the Tory Secretary of State for Health. And I think that the crisis that now afflicts the NHS is far bigger than, oh, it's winter, it's cold, or oh, people have gotten older. Yes, they have, and yes, it is winter, but that's nothing new. That happens every year. People have been getting older for a while. It's a problem of underfunding, not enough resources, stretching staff to do more with less. In the long term, clearly not possible. So today I'm going to outline 4 key indicators of why the NHS is failing and why Jeremy Hunt should resign. Number 1, ambulance emergency response times. So ambulances need to get to critically injured people who could be facing death potentially, within 8 minutes. That's the target, okay? There are 13 ambulance trusts in England, Wales and Northern Ireland. 13. How many of those trusts do you think made their targets and getting to critically injured people within 8 minutes? 13 trusts. How many made it? One. In 2016, 1 million people weren't seen within 8 minutes who were in really serious danger. 1 million people who were critically injured weren't seen as quickly as they should have been. 1 million. 35%. So if you were hit by a bus or in a serious incident, you could be in real big trouble. There's a 1 in 3 chance you wouldn't be seen as quickly as you're meant to be by an ambulance. Now that's obviously going to lead to avoidable deaths. Now this isn't to blame paramedics or ambulance services. They're not farting about, they're not lazy. It's because when they take people into hospital, when they take people into A&E, they have to stay with them until those people are enrolled into the system. Now, because there aren't enough beds, that can often be for 2, 3 or 4 hours, sometimes more, before they go back out again. So people are dying because of this lack of beds, avoidably, right? And that's not just me saying this. Coroner last year said that since 2010, 35 people have died when they shouldn't have because ambulances did not get to them quick enough. Now, clearly, the number will probably be much, much higher, but that number of 35 is indisputable. So, to recap, this is a really bad statistic. 1 out of 13 ambulance trusts is meeting this target, and it's leading to avoidable deaths. You can solve it, guess how? More paramedics, more money, more hospital beds. Number 2, ambulance and emergency waiting times. This is the one everybody's talking about, right? So there's another target here with A&E services. 95% of people that go to A&E should be seen within 4 hours. That's the target, 95%. Dr. Taj Hassan of the Royal College of Emergency Medicine has said in some departments last month, well actually in many departments nationwide, it was 50 to 60% were being seen within 4 hours. So there's a huge problem in regard to A&E, people having to wait longer and those targets aren't being met. In the words of Dr. Taj Hassan himself, figures cannot account for untold patient misery. Overcrowded departments, overflowing with patients can result in avoidable deaths. Now just look at this graph, okay? The Tories come to power in the summer of 2010. There's tens of thousands of people that are not being seen within the 4 hours. Where is it by January 2016? It's over 200,000. So between summer 2010, January 2016, it's up by over 500%. 500% increase in people having to wait 4 hours or more in A&E, okay? That's not a year-on-year thing. The trend's obvious. It goes beyond 1 year. It goes beyond people getting older or it being cold. And guess what? In the last 12 months, things have got a hell of a lot worse. Okay, so you'll probably be seeing between summer 2010 and the next general election, what? At this rate, something like 1,000% increase in people not being seen within 4 hours at A&E. Unsustainable, and just like with paramedics and ambulances, it means people are dying when they shouldn't be because there are not enough resources in the NHS. Number 3, treatment waiting times. Okay, so this is not dealing with avoidable deaths like numbers 1 and 2, but it's still very, very, very important. So referral to treatment, treatment being things like cataract removals, hip replacement, knee replacement. The target is 18 weeks from referral to treatment of 92%. So 92% of people who are referred for treatment in regard to these things, pretty bad things, but not life-threatening, right, should be seen within 18 weeks. That target is being missed. More people are not being treated within the 18 weeks than ever before. And guess how long the waiting list is? Remarkable. 3.9 million people waiting for a regular treatment like cataract operations or a knee replacement. Now, you might not think that's such a big deal, but 3.9 million people who potentially can't work, potentially can't care for one of their parents or grandparents, potentially can't look after their children. can't earn a living, decreased quality of life, perhaps suffering mental health issues because they can't exercise. This is serious, okay? And it's a lot of people, like I say, nearly 4 million people. It'll be more than 4 million people next year. Again, that kind of waiting list, that kind of failure with people having to wait for treatment hasn't really been seen for the last 6 years. All of these kinds of things, just like with A&E waiting times, just with ambulance response times, they've gone down. And guess what? They're going up again. Over 4 million people next year will be waiting for pretty regular, easy to do treatment. This is a pandemic of inadequate care in our National Health Service. Again, very easy to sort out. More money, more doctors, more resources. It's a question of political will, not the fact that people are getting older or because it's the winter. I'm really sorry, Jeremy Hunt. Number 4, the NHS is understaffed. Last summer, there were 23,440 vacancies for nurses in the NHS. Guess how many there were in 2013? 12,500. So you're almost seeing a doubling of vacancies for nurses in the NHS. By the way, that 23,400 figure, guess what? That's 9% of all the nurses in the NHS. There is a chronic shortage of nurses in the NHS, but it's not just nurses, it's also doctors. There were 2,900 vacancies for doctors in 2013. Now there's 4,600 vacancies. There's a huge, huge shortfall. And actually, just a Commons report a few months before we had this humanitarian crisis, as the Red Cross called it in the NHS, a few months, early last winter, said that 3,000 more doctors were needed in NHS A&E departments, otherwise there would be a crisis in A&E. Oh, well, guess what happened? So there were 3,000 more doctors needed. NHS England A&E departments need around 8,000 doctors to make ends meet, to cope. Currently we have around 5,500. So you need about a 50% increase in the number of doctors in A&Es just to make ends meet. Now all of this was presented to Jeremy Hunt, to the government, to everybody in the House of Commons, just a few months before those 2 people tragically died in Worcestershire a fortnight ago. So they knew all this was happening. It was laid out very clearly in front of them, and they did nothing about it. And by the way, guess what the biggest risk of a 7-day NHS is? That's right, staff shortages, overstretching people, asking them to do more and more with less and less. And by the way, guess what? Another interesting statistic, NHS nurses taking more time off than ever before. Not enough of them, the ones that are working are more stretched, more distressed, more anxious, more ill, because they're being asked to do an impossible task. It's not good for them physically or mentally. If you want to destroy the National Health Service, guess where you start? You destroy its staff. So I've just outlined 4 key measures where I think the NHS is failing. I could do so many more. Ambulance response times, A&E waiting lists, referrals to treatment, staff vacancies, which of course denotes not enough people in the system to make it function effectively. I could do so many more. Cancer treatment, waiting times, massive failure there too. This is a political failure. These failures are not just this year, last year, they're over the last 6 years, and they're getting worse over time. And if the next 6 years are as bad as the last 6 years, we won't have much of an NHS left. How do we sort it out? Well, more resources, you pay people more, you stop the outsourcing, you stop the privatisation. That's easy enough, right? But it requires political will. First things first, we need to get Jeremy Hunt to resign. Jeremy Hunt, please just fuck off. Thank you.